Hello viewers, my name is Johnson Wambugu. I'm a member of the PCEA Ongata Rongai Health Board team. I'm a paramedic by profession as well as a safety officer. So today we're going to discuss, I'm going to educate, enlighten you about the myth busters, things that we think we ought to think that they are the right way or they are associated with coronavirus, but hence they are not. So just to enlighten each other and to see how we're going to be safe all the time. So the first one I'm going to talk about is the prognosis of coronavirus. Can one heal after being infected with coronavirus? Yes. People get healed. We have so many recoveries, and initially people who are positive, after maybe 2 weeks, they've turned out to be negative, first test, negative, the second test. And yes, we do say people can, people do get healed out of coronavirus. The next one we're going to talk about is alcohol. Can drinking of alcohol cure coronavirus or prevent you from coronavirus? No. Actually, drinking of alcohol will bring more problems to your health, and as well it can predispose you to other health problems. So alcohol does not cure or does not prevent COVID-19. Another one that we're going to discuss is what around people are talking about is if you expose yourself in higher temperatures above 25 degrees, will coronavirus not get you? Will you not be infected with coronavirus? No. Evidence has shown some parts of the countries where the temperature is above 25 degrees, individuals have been infected, and countries where the temperature is quite high, individuals have been infected with coronavirus. Something else we're going to talk about is cold weather. Does it mean that when you stay in cold weather, you will not get coronavirus? No. Your body temperature remains, it's still the same. Either you are in the cold air environment or which other environment, it remains to be 36.5 to around 36.5 to 37. So staying in the cold environment will not prevent you from getting coronavirus. How about those people who are saying when you are in areas which are very hot, extreme hot areas? We have some of the places which have extreme temperatures ranging up to around 50 degrees. Will it prevent you from getting coronavirus? No. Evidence has shown in some parts of the world that even where there is very high temperatures, above 40 degrees, or humid areas, the chances are there that coronavirus will exist. So I'll still urge you people to continue washing your hands, maintain social distance, avoid touching your nose, your mouth, and your eyes. Some of the queries I've had from people, they're talking about the 5G internet, 5G network. Does it predispose you to coronavirus? We say no. Coronavirus does not spread using mobile waves, electromagnetic waves, or any radio waves. The spread of coronavirus, the COVID-19, is basically through droplets. So the myth about the 5G, it is not there, because we have countries that do not have 5G, and there are so many cases of coronavirus in those countries. Again, we're going to discuss some of the questions that we are receiving about the hand dryers. Can hand dryers kill coronavirus? We'll say we don't have evidence of that, so we'll not advocate people using the hand dryers to kill the germs to kill the coronavirus. So we still emphasize on washing your hands with soap and water. If you do not have that, go to your alcohol-based hand rub and wash your hands. Avoid using the hand dryers for that. Only do that. Use the hand dryer when you're done with washing your hands with soap and water. Now you can use the warm hand dryer to maybe not dry your hands. Good. Some of the myths people are talking about is How do you detect one has coronavirus? Some of them are saying that you hold your breath for 10 minutes, for 10 seconds, for 10 seconds. Will it show you that you have coronavirus? No. Even if you hold your breath and you don't get any discomfort, and even if you manage to do that, it does not mean that you cannot get coronavirus, or it does not screen you from coronavirus. The only way we can say one has coronavirus is through lab testing, and when the results are out, you'll be able to know if you're positive or negative. So that is a myth. So just I want to set the record straight so that everybody can know. Some of it saying about the UV disinfection. We have the UV disinfection lamp. Can people use it to disinfect their hands? You pass your hands on the UV disinfection lamp? No, it is not advised, because the UV continuous exposing your hand to the UV disinfection lamp will expose you to more other skin problems and skin infection, which is not right. Hence, we still emphasize on what you're saying. Continue washing your hands with soap and water for a minimum of 20 seconds. If you don't have that, you can as well now use the alcohol-based hand rub. The sanitizer should have more than 70% alcohol. Good. We continue. How effective are the Tamaguns? You've seen them in the supermarkets. A gun is being pointed on you to check your temperature. Can it detect if you have the coronavirus, the COVID-19? No. Basically, the Tamaguns, what it does basically is checking the fevers. Check if someone has a high-grade fever around more than 37.5 and above, or to see if there is temperature. Now you're going to be quarantined or set in an area for observation. The Ministry of Health will be called. They're going to examine you. They're going to get you and take you to quarantine areas to see, and the test will be done. If it is positive, yes. But the scanners, let's say, they will not say if you have the virus. Basically, it's just for the fevers, and the fever is one of the symptoms of coronavirus. Good. Some of the questions that are coming up, is we do have some of the vaccines. Let's say coronavirus does not have vaccines, but we do have some of the vaccines, such as pneumococcal vaccines, which are given to people, children. Do they prevent you from coronavirus? Today we are saying no. The vaccines will not, the pneumococcal vaccines will not prevent you from coronavirus. What we can say, the vaccines will help you from against other pneumonias, but up to date, we do not have any vaccine for coronavirus or any definitive treatment for COVID-19. How about eating of garlic? Can eating of garlic help you not get coronavirus? What you can say, garlic itself has some extent of antimicrobial agents in it, but it does not have any evidence. Up to date, we do not have any evidence or scientific studies that shows that eating of garlic will prevent you from getting coronavirus. We also have some people who are saying about staying in the sun, basking in the sun. Will it prevent you from getting coronavirus when you expose yourself to sunlight? No. Even if you expose yourself to sunlight, you'll still, there are chances, places where people live entirely on the sun, outside on the sun, there's chances that you'll get coronavirus, as evidence has shown that. Something else, when you spray yourself, we've had questions, when you spray yourself with alcohol and chlorine, that you're going to kill the coronavirus. No, coronavirus exists in people. So spraying oneself with the alcohol or chlorine will not kill the coronaviruses. Something else, some of the questions again we are receiving is about taking of antibiotics. Do antibiotics work with the COVID-19? Today we are saying no. Antibiotics do not work for viruses. Antibiotics only work for bacteria. So why maybe in the hospitals antibiotics can be given, basically it's because of co-infection. Someone has the COVID-19 and as well they do develop bacteria while at the hospital. So that's when the antibiotics will be given. But don't take routinely antibiotics to prevent coronavirus. Do we have any specific treatment for COVID-19? No, up to date we do not have any specific treatment for COVID-19. And maybe you can say the last question, which I'm receiving also from people, is COVID-19 sexually transmitted? We say no. We do not have evidence of COVID-19 being sexually transmitted. Thank you so much, and I urge you, if you have any questions, you can always direct them and channel them to us, and we can always answer you back. Stay safe. Thank you so much.